Welcome. Step into the Mindora Lab. On this podcast, we will be discussing the practices, research, science, and technology surrounding alternative medicine, where listeners will gain valuable insight and information with every episode. Just as a reminder, the Mindora Lab podcast is for educational and informational purposes solely. All subjects discussed on this podcast should not be construed as medical or legal advice. You should always seek out help from a professional provider. Thank you. Hello everyone. Today on the Mindora Lab podcast, we are going to be talking to Leigh Farquhar. How are we doing today?
I'm doing really well, Dorian. Thank you. How are you?
Doing well. I'm super pumped to interview you. Thank you for taking the time to get on the podcast and do this episode. I know we've been chasing each other back and forth after post-festival sickness, and we're finally better and ready to rock and roll. So
Absolutely, yeah. Thanks. I just want to make a point to say thanks for having me. I greatly appreciate it.
Absolutely. So let's dive into the first question. Where are you from and where'd you grow up?
So I'm originally from Little Rock, Arkansas. Excuse me, I'm still on the tail end of recovering from that aforementioned sickness. I'm originally from Little Rock, Arkansas, but I was raised in Metro Detroit, Michigan. And I have lived there my entire life, but I'm currently in Madison, Wisconsin.
Wow. So Midwest all the way. I was actually born in Iowa and then moved to Vegas, then grew up there.
How long were you in Iowa for?
So I actually was there from the age of, I think, 10, 11 before I moved to Vegas. So I actually got to experience what seasons were actually like, but I hated blizzards.
Fair enough. Yeah, the winters can be pretty rigid.
That and then also the scares of twisters were not it.
Yeah, see, I don't have to worry about that threat in the Midwest. So my area of the Midwest, at least.
Yeah, no, the tornadoes were the scariest part of living in the Midwest. So growing up in Vegas, getting that heat wave, I was like, I mean, this is an adjustment, but at least I'm not gonna get like twirled up into the sky.
True. No, don't have to holler for Auntie M.
No. So, which college did you go to, and what did you start studying when you moved to Michigan?
So initially, this is kind of funny considering the line of work I ended up in, which I know we'll get to later. But I was originally a double major, criminal justice and psychology. And then I quickly realized that there's not really a way to do progressive prison psychiatry because it's, closed system, and it is what it is. Self-sustaining system. If you know, you know. If you don't, take a look into that. Do a quick Google search. But then I quickly transitioned into psychology, followed that all the way through until I graduated from the University of Michigan Dearborn in 2022. And I am currently at the University of Wisconsin-Madison pursuing my Master's of Science in Pharmacy for Psychoactive Pharmaceutical Investigation.
What would you like to do with that master's? Like, what's the progression now?
So at this point, I used to want to be super research-oriented, research-based. I did want to do PK/PD studies, so like preclinical stuff, and then potentially transition into clinical trials. But I'm really realizing that with the way that the psychedelic space is opening up, I'm kind of being called back to my psychology roots, and I very much want to go into integration therapy. So despite my previous thought, I kind of got steered in another direction, and I'm definitely looking into integration therapy. Potentially, research is never off the table, right? But yeah, definitely more on the applied therapy side of things.
Can you break down integration therapy for the audience?
Yeah, absolutely. So integration therapy is essentially a creation of a container where one can safely experience like literally integrate like re-experience and integrate their psychedelic experience. So they take the lessons that they are able to recall, and like talk them out with a therapist in a way that makes sense to them and apply them to their day-to-day life for a more holistic sense of well-being.
That's awesome. Which psychedelics are we talking about here?
So without getting too much into the weeds, um, I kind of want to be open to all psychedelics. I don't think that any type of psychedelic is inherently better or worse than the other. I think they're all, like they all have their specific purpose and everyone is called to one or another for a specific reason. I more so think that the integration of the experience, regardless of substance, is more important than the substance. I
Mm-hmm.
do think that there might be modalities that are better for certain substances than others, given the context of the experience. But again, that's so variant that I think just like making sure that people have a safe place with a trained professional who understands A, the psychedelic space, and B, the pharmacology can create a very, solid therapeutic alliance to be able to see long-standing change. And one more note on this, I won't drone on too long about it, but
No, no, keep going.
the current clinical model only provides for 3 to 5, I think 5 is the cap, 90-minute sessions
Mm-hmm.
of integration therapy after the fact. And I don't know the exact window of that length. And I think that that is another reason that integration therapy is important, because if we're operating off of this clinical model, right, what do we do when the fifth session ends and someone requires more care? And they might not be working with a therapist who has the tools to understand the psychedelic experience rather than, like it's still a part of the human experience, but it's just that second layer of understanding is so important for someone to be able to feel seen and build therapeutic alliance, which is it has been deemed the most important quality between a therapist and a client.
Yeah, no, I completely agree with what you're saying, and it is a challenge that you're going to have to face, and the rest of the United States will have to face with determining what is the actual length of, or I should say, limit of sessions that patients should have, right? Because what if you can't get everything out from the patient's framework internally, and then they go off and now they're alone in their approach? Like, they had necessary tools, they had necessary treatment
Mm-hmm.
models, and the actual counselor who was guiding them through what they needed to fix, and now they're cut off from that. Is that patient going to go and try to find that compound recreationally and try to go down the rabbit hole by themselves? Or, could there be another detrimental outcome from not seeking further treatment?
Absolutely, there's a lot of moving parts there. Generally, they double back and make sure that this person has a therapist
Okay.
that they'll be output to. But I think the problem with that is also we're not considering different demographics of people, right?
Hmm.
Um, there are certain demographics of folks who might not have as much access to those areas, those being like socioeconomically challenged folks or
Right.
people of color, both of which are highly underrepresented in clinical trials. So those people might be able to continue to fall through the cracks as we currently see in our mental health care system. And alongside that, too, um, again, it brings me back to, is that therapist that they're seeing trained or at least have an understanding of what their client just experienced? Because it does
Mhm.
differ from the day to day, like human experience. It's something ephemeral, ethereal. It's hard to grasp.
Right, and everyone is going to have a personalized journey themselves, because not everyone's going to experience the compound or the treatment in the same manner, or they're not going to have the same takeaway, because it's not going to be a one size fits all. And that's been the Western medicine approach for the longest time. And that's one of the reasons why I wanted to focus on bringing alternative medicine to the light
Mm.
through this podcast, because these are the difficult conversations that need to be had. We need to start addressing how we move past the models that are currently not working for everybody, or for that matter, are accessible.
Accessibility is so huge. Everybody deserves the right to wellness. And I don't think that there's just many systemic, classist, racist, among other things, like that prohibit everybody from achieving equity in their personal well-being space.
Absolutely. So let me ask you, when was the first time uh, you were introduced to alternative medicine?
It's such an interesting question. I haven't really like considered that. It's been quite a journey. I would say it's been an on and off journey. I would say probably 2018 was when I really began realizing that there were other options.
Mm-hmm.
Um, and then I wouldn't say, I mean, I feel like this is quite a common journey. I don't mean to speak on behalf of all the listeners, but I feel like when you hit that inflection point, right, you kind of almost go down like a little bit of conspiracy,
Yeah.
and then you keep pulling back the curtain, right? And some of it is debunked, but for the most part, you're like, wow, that some of the stuff that I'm taking and that I'm told is safe is actually making me sick.
Yeah.
Yeah. So I think that it was a lot of really learning to trust my intuition regarding what I should be putting in my body and what I shouldn't be. And
Mm-hmm.
holistic had always just felt right, but there was always that societal, um, and again, I don't mean to overuse this word, but that systemic like implication that we should be adhering to what doctor says all the time.
Mm-hmm.
And we
Yeah.
know, especially in women, medical gaslighting is a particularly large problem. So it's just, yeah, it's been really interesting to be on the holistic health journey.
And in 2018, was that cannabis? Was that a psychoactive compound other than?
Yeah, it actually was a psychoactive compound, that of which I'll refrain from naming, but
Mm-hmm.
it just kind of made me realize how I was treating my body,
Mm-hmm.
and that something needed to change. And I felt, for whatever reason, that there was a lack of power, like personal power within me to make those decisions that are the best for my well-being. And I think that really drove my dive into alternative medicine, and really like beginning to take, um, I wouldn't, I mean, I guess honestly, truly, yeah, take a chance on myself rather than putting all of my beliefs into what I'm being told by someone I don't really know at the end of the day, right? And they don't
Right.
really know me. They just know me as patient number whoever.
And you're taking it with a grain of salt because you want to do your own research to see if this actually works for your body. And ultimately, that's a good freedom that we have in America,
Mhm.
is that we're able to make those distinctions, and we're able to start connecting the dots of what's working and what's not, and we're not forced to continue to take something.
Absolutely. And I want to make a point in saying that this is not by any means me saying that I don't believe in the place that healthcare holds. I think that it's important. I think that we need it. I think that we wouldn't really be able to fully function without it. But I do think, just to drive the point home, that there should be more of a team dynamic and more trust from the practitioner into the way that the patient feels within their body and what intuitively feels right to them.
Yeah, absolutely. It's more of a preventative approach more than a reactive approach, right?
Absolutely.
So, with that being said, when did you enter the cannabis industry in Michigan?
I entered the cannabis industry in 2019, and I spent almost my entire career with the same company.
Mm-hmm.
They ended up going, I wouldn't say going under. They sold out. They wanted to tap out, so they ended up selling out in 2021 or 2022.
Mm-hmm.
And I followed my crew, who I liked working with very much, to the next spot that I worked at until I ended up moving to Madison.
What were you doing at the other spot?
Same stuff. Managerial, like inventory specialist, was where I was. It was my point of expertise. So buying in, overlooking testing, just to make sure that everything was as it should be, keeping kind of inventory, stuff like that. It was kind of like an even split between general manager duties and also inventory specialist duties.
And remind me again, when did Michigan go live for medicinal and recreational?
Oh man, that's a question that I haven't had to answer in a long time because it's been so long. Allow me to double. I want to double check myself on that. I know Rec was recent. I want to say Rec was 2020, maybe 2019. Let's take a look. Like I said, I don't want to speak out of
Yeah,
integrity
for sure.
here. Yeah, so 2018 actually was
So
when we
right.
had both. So that would have been adult use became legal in 2018.
So
And I
right
want to
around
say
the
like
time.
between 2013 and 2015 would have been when med was just really starting to pop off in our area.
I see. So 2018, it aligns with, you getting introduced to alternative medicine. It's wild.
Yeah, kind of
So
interesting there.
yeah, that's a coincidence. And I think with you going into that, what were people asking for when you were in that retail space? Like, what are the trends that you notice from first time patients?
It's always been hype. It's always been, I heard that this is the most potent item that you have, which
Mm-hmm.
fine, potency is fabulous. It offers the medicinal benefit, right? It
Right,
does all of the quote unquote all of the things, creates a it really does emulate that entourage effect, right?
right.
Um, the issue is people are asking for things that they're not entirely sure about and they have
Mm-hmm.
no way of fact checking, right? Especially at that time.
Right,
There was no QR code on the back of your bag that said scan for test results. And we as distributors, we didn't know, you know, nobody knew.
mm-hmm.
Only the parent company and the lab knew. So, the strongest stuff was really um, sought after, but to the degree to which it was compliant, I don't think anybody really knew.
Mm. Interesting. Yeah, because I worked in the storefront for about 3 months. And I think Oregon went rec, and I have to double check on that, much earlier than Vegas did. And so it was a saturated market in 2019. But, with the amount of time from it being medical and recreational, it gave enough time for them to put everything on the label with the COA plus the details of what was in the packaging. Yet with new markets that emerge, it seems like they're missing that right off the bat, right?
It's really interesting. I've never really considered it from that angle before. Yeah, I'm seeing, like I said, I'm seeing QR codes, but I'm not seeing as many warnings on the bags. I'm not seeing
Mm-hmm.
as much compliance on the bags, especially in spaces. For context, we have a lot of Delta 8 hemp compliant shops in Madison because of the Farm Bill.
Mm-hmm.
Um, and for those who are not familiar, that law states that any hemp plant that is grown and manufactured for distribution has to have less than 0.3% Delta 9 THC. So it's really interesting because you're getting these products, right, that are quote unquote hemp compliant, but you don't know what else is going into it. And even though you can scan the test, a lot of people I have talked to have said that they have trouble trusting the test
Mhm.
because they're like, okay, well, like we know that Delta 8, Delta 10, Delta 6, THCP, THCO are still psychoactive, right? But
Mhm.
to what degree, I guess I just get a little bit lost when it's not, I guess, forthrightly put on the bag in the appropriate way. And
Yeah, no,
trying
I
to gather my
understand what
thoughts
you're
on
saying.
this.
Yeah, no,
Um,
it's
the
hard
warning
to.
label is not really even that big anymore, I guess is my point. It was a long-winded way to get there, but we got there. It just seems a lot different now. The new wave of cannabis marketing and compliance and labeling seems to have changed in a way that only perpetuates the consumerism aspect of the substance.
Mm, yeah, no, I could definitely see that, and I think there's going to be a further push for standardization, especially with all of the recalls that are happening in major states that have come online and are now seeing the ramifications of poor testing practices with
Mm-hmm.
improper instrumentation or techniques. And if they're and this was something that previous guests brought up, is that in the pharmaceutical industry, when they advertise for a drug on a commercial, even at the end, they're mentioning a disclaimer of all the side effects that can happen because they know that they have to list all of those warnings at the end because they're advertising to a public audience that's going to be consuming this. Now, with cannabis, that standard is not is upheld.
Yeah, I like that you bring up that point, because having read a considerable amount of scientific and scholarly literature on the topic, given my studies, we don't in this moment even really know. We know that there are some adverse events, I'll say AEs for short, associated with it, like heightened anxiety. Some people have cardiac issues or, things like that, those of which should be on the bag. But it's still the mechanism of action even is still relatively unknown. It's elusive in a way. And our endocannabinoid system is so vast and so expansive that it's still relatively novel in the space of research. I don't know if you can attest to that at all or follow up with any personal opinion on that, but I think that speaks to the lack of warning that there is and really speaks to the ambiguity of outcome, because we don't have any long-term data on that.
No, and I agree with that 100% that there needs to be grants and more scholarships presented to colleges that can focus on the chemistry, that can start doing some clinical trials that are testing on patients for a long-term study to see the mechanism of action. Because right now, it's barely getting pushed to the surface on how much research is available for the public to see and how much can actually get published, because there's always going to be interest from other companies that don't wish for these results to come to the surface
Mm-hmm.
and get sidelined for years, because guess what? You're still on a Schedule 1. you don't
Right.
deserve you don't deserve the right to have this research get published or put and come to fruition, so that we can actually get to a place where we can recognize this as a medicine of some sort, instead treating it like a product,
Mm-hmm.
and with that, that's dangerous.
Absolutely. I would also say, though, that we can't, and this is not to assume that you feel this way,
Hmm.
but we also can't assume that it's a panacea, right? As we can
Mhm.
with any. This goes for any psychoactive substance that is. I should say psychedelic at this point because this also ties into psychedelic research as well. We cannot go ahead and assume that it's going to cure everything, right?
Right.
So something important to keep in mind there. And also, the underground is never going to go away. So we will have this duality of use. And at that point, when considering that fact, I guess my question to you would be, what do we do to mediate that risk for the people who might not necessarily have a means by which to engage with the FDA approved substance? Because will they keep getting this I don't want to say quality in the sense that it's quality. I guess I could say, I guess it would be, I don't even know what I would call it. I might call it less reliable, less
Mhm.
consistent
Mhm.
product than the people who
Mhm.
are able to engage with it from, like a healthcare standpoint. How do we account for that duality that will likely come about?
Yeah, and I think that's going to require a full rescheduling and then also have the same standardization that gets put into place for pharmaceutical drugs that come online that have to go through multiple clinical trials before they're even considered being able to be released out into the public atmosphere for therapeutic benefits. Right now, with each state having their own rules and regulations, they're all going to differ through testing, through post processing, through compliance labeling. And until we all get on the same page of sharing results from the experiments that are being performed and collaborating to make a standardization for cannabis, for psychedelics, for anything novel that's coming into the market, only then will this actually start to be a productive industry. But right now, going back to what you said at the beginning, all hype.
Is that the prompts to dive into the hype market?
Yeah, let's talk about the hype market.
All right. There's a few places I guess we could start. I feel like maybe percentage, the
Mm,
percentage game. And that goes back to
yes.
research too. What are your, I have many opinions. Where would you like to start on the
I,
percentage game?
I think there needs to be a lot more education on the minor cannabinoids, and there needs to be more research on that so that people can start understanding what the other minor cannabinoids are contributing overall to the experience and not just focusing on the THC experience, right?
Yeah, absolutely. Um, I it's really difficult to I don't want to say persuade, but I suppose educate would be a good word to use
Yeah.
because it's not a means of persuasion. It's a means of trying to speak science in plain language, right, and translate that
Mm-hmm. Mm-hmm.
to the community. That was something that I struggled with greatly working in retail. People do not want to hear, for the most part, what you have to say about emerging science.
Mm-hmm.
And I'm not sure why that is. You maybe get one, I guess I would say I would get maybe one in every 15 customers who would come through the door willing to hear my spiel on phytocannabinoid science. And I found that to be
Mm-hmm.
very interesting because as like a scholar, all I want to do is learn, right? If someone
Right.
comes to me with like emerging science about what it is that I'm consuming, specific, like especially in regard to what I'm consuming, I'm certainly going to want to hear what they have to say. And that's not to say that
Right.
I need to be listened to or this or that, but it's so interesting having someone come in and you offer them, I guess this was what was difficult for me was you offer them insight on how to find out better for themselves what works for them.
Mm-hmm.
So suggesting terpene profiling actually allows the user to break down the constituents of their favorite strain. So if they're like, say someone comes in and says that they love X strain, if I can break down the terpene profile, then I can make a suggestion. I want the customer to be able to do that in their own space, so they're
Mm-hmm.
not reliant on me, right? Like, we all deserve to be able to make informed decisions.
Mm-hmm. No, that's definitely something that I thought about, and how I thought about that avenue, delivering that through a phone application where people would want to do their research before buying a product. And there's actually an app that came out in 2020 that's called Tetragram that is actually doing this, where they are partnering up with clinicians and physicians who are doing studies on the products that are helping alleviate medical conditions. And these people can use the app and link up with communities who all use the same product that are helping with their medical conditions in their respective states. So, that is a tool that's available for people to use right now. And I'll repeat that again. It's called Tetragram. And I just found out about this through MJ BizCon, because I had this idea of like connecting actual medical professionals with cannabis integrated into an app, and then having the patient decide on what product they're going to use based on someone else's experience through that product, or just even someone that's educated that can break something down into layman's term for the patient to understand that this is going to help X symptom and alleviate it for X period of time. So, I think there needs to be definitely more resources for people to engage with. However, if it's not 30 seconds or less engaging, you're going to lose somebody, because that's just how our society is moving now, right? Where our attention span is getting shorter and shorter and shorter. So if you or I are welcoming a patient to come in and talk to us about, or ask us questions rather, about a product and how it would better serve them through a scientific standpoint, then we're going to deliver that message as best as we can, because that is in our nature. However, if the other 14 people don't want to hear that, how do we break that cycle? How do we help them make informed decisions? And doing that, I think, is by having these conversations, having the podcasts, the episodes, and talking to more people who are having similar feelings.
Absolutely. Yeah, that was very beautifully said. I could
Thank
not
you.
agree more. Yeah, absolutely. No. It's just, it's so interesting to hear it spoken about in a patient manner. Because
Mm-hmm.
I don't know if you feel similarly, but I feel like there's maybe this is an underlying issue with it too that becomes subconscious to a degree. Uh, the industry is very urgent.
Yes.
It's always been urgent. It's still urgent. And I wonder if it will continue to be urgent because, again, we're speaking on hype, right?
Right.
Hype is urgent. And I don't mean to, this isn't to talk ill on this brand, but I've noticed, because I'm not really familiar with any of their lab results or anything like that. So I can't speak to
Right.
the integrity of their product. But I have noticed that urgency plays a particularly large role with
Never heard of that, Bren.
so they're pretty popular in the Midwest. They're very well known for their keef dipped joints
Mm-hmm.
that have rich taste. They fly off the shelves, man, quicker than anything that I have ever seen. And the amount of people that come in asking for that product
Mm-hmm.
is incredible to me, and it's so urgent. it's not just like a, hey, are you carrying Jeters in this moment? It's like, hey, like I heard from like A, B, C, D, and E, and like Cannabis Cup suggested that this was like the thing that you want to smoke. And I'm like, whoa, don't, yes, it could very well be, but also don't you want to like, I don't know, consider like what it is that you might be ingesting as well. Like I'm not, again, I'm not attesting to the purity of their compound. I'm just like curious as to like to what degree urgency and hype drive this market rather than like um as you were being so patient, I will say patience.
Right. No, it's just I think we've entered into this period of time where everyone got super excited about recreational marijuana, but didn't actually do the hard work prior. It focused more on how can we mass produce this and make as much money as possible, but not stop to consider the actual puzzle pieces that need to get put in place beforehand. And, when I refer to customers as patients, as bud tenders, it is a very important role to play in the retail space because you are essentially a you're a provider at that point. You're supposed to be handing out a product that is going to either give someone a positive experience or a detrimental experience. And
Mm-hmm.
if you're not doing the research prior, no one's educating you on the ramifications that a wrong product could have to a customer, to a patient, then there ends up being these people that end up in the ER and they're like, I don't know why. And it's like, well, I can tell you why. You weren't educated through the person that was selling this to you or the actual company that should be providing, like you were saying, those warning labels on the packaging.
Absolutely. Yeah. And I think that goes to show too, um, where we are in terms of, again, going back to the discussion of the hype market.
Mhm.
It has overtaken it has overtaken the space for the most part. And I know we touched on percentage and we were giggling about percentage. We didn't even really talk about it because we got sidetracked, but
Yeah,
I'm going to call it back in.
yeah.
People love to come through and say, I'm looking for the highest percentage product that you have.
I love that statement
Me too,
every
because
time.
because that's when I try to begin my terpene spiel, or
Mhm.
my phytocannabinoid science spiel, and that's where people's eyes glaze over. I just really think that it's a very multi-layered. It almost seems to be like a cemented in experience for most people who are engaged in the cannabis space. Even people, so I was going to make a point and say that we need to keep in mind that recreational use is certainly playing a particular role in this outcome. But in saying that, I wouldn't be speaking entirely in truth because I have had patients come in who have been predominantly medical, and like they were medical before it was rec, and like I guess you could call them a regular, who would come in and say they need the highest percentage and they wouldn't be willing to have a discussion. And the science is showing that terpenation does have a lot to do with the effect and the outcome and the cascading of the entourage effect, and it's very interesting to see that from a sales perspective because it tells
Mhm.
you a lot about where people are at with not just their willingness to accept new information, but their access to that information too, which I think is a little bit gate kept. And I particularly think that that's the case in regard to testing.
Yeah, no, I love how you bring up gatekeeping, because I think that's what's happening in this industry, is that there is not a lot of people that are being outspoken about bad practices. I think we're just kind of just sweeping things under the rug and just saying nothing to see here. Let's move along. Let's keep the hype moving, because um, pointing out things that will actually need to change to make better product, and understanding that the research and development can't be rushed. It needs to be meticulous, it needs to be thorough, it needs to be tested, tried and true, and then release it to the public, where you know for certain that this is going to be a consistent result that's being delivered.
Absolutely. And I also wonder too, because again, speaking on testing, and not even outside, like, because yes, I fully and wholeheartedly agree that the research is integral to the continuity of the integrity of the medicine,
Mm,
like at its fullest, at its like fullest degree. Because if the research can result in efficaciousness, then there is a full like green light go ahead to implement more like stricter testing measures for, I guess, recreational and non-medical distributors and manufacturers. There it
mm,
is.
mm.
um so yeah, I don't it's really interesting to kind of just see how it's all been unfolding. And I feel like even discussing it a little bit, you can see how many different directions we're going in, and how at the end of like a couple of points, it gets a little lost in translation because there's so many moving parts. And I
Mhm,
think that that also makes it difficult to manage, because if it's this difficult to discuss, right, and keep linear,
mhm.
how do we keep the actual industry linear and accountable?
There it is. That's the word that is going to be continued to be discussed, I think, on this podcast, is companies need to be held accountable for what they're delivering out into this industry. That's how businesses and companies always operate, right? If there's a product recall on a farm that's sending out romaine lettuce that is giving people E. coli. Well, guess what? All of the stores that it's sold to, now all of it has to come back. It can't get retested and put on a shelf. If a cannabis company can do that, then what are we doing here? Like, why is that legal? Or if so, that product's probably going to get sold on the black market. So this is the reason for standardization, for compliance, for regulatory agencies to step the fuck up.
Absolutely, I'm in concurrence with that. That leads me into an interesting point, regarding testing and compliance. I will say my faith is a little bit skewed, because having worked in inventory and having had access to state results, there was stuff. So there, I don't know if this is legal or illegal. This is probably non-compliant, but I remember seeing that there was a flower that I had bought in, um, that had a mold count on it. It was flagged for mold. It wasn't
Mhm,
very high. The CFU was very like minimally over the max allowance, which there shouldn't be a max allowance, but there is. And for those who don't know, CFU is colony forming units.
mhm,
Um, and it was just above that threshold. And I asked like my GM, I said, "Hey, I got something weird on this buy-in, and I don't know if I should like fully buy it in all the way. Like, can we send it back?" And they were like, "No, they shipped it out to us. We have to buy it in, and we have to sell it, or it has to be destroyed." And I remember thinking in my head that that can't be right. And I asked a further question. I said, why can't it be given back? And they were like, oh, because we paid for it.
Mm.
And then that was the first moment that I knew that this was a money fueled industry, and that it didn't
Mhm.
matter about the testing. It didn't matter about this. It didn't matter about that. Like, the money was corrupting the system.
Mhm.
And I think that's a
Yeah,
whole other can of worms, but
yeah, no, that's definitely a pivotal point for you to note, and that probably changed the trajectory of do I stay in this industry now?
yes, very much so. For a point, it was job security, but at that rate, I was on the sales floor. I made a point to make sure that I was on the sales floor telling people, hey, you probably shouldn't buy this because it has mold in it. I'm the inventory manager and the inventory specialist. And like, I saw the test results
Hmm.
and I'm surprised that it didn't cost me my job. I'm really not. Someone must have not been checking the cameras or the audio that day, because that day, those days, months, however long it was,
Hmm.
I was just whistleblowing my patukas off, because I was
Hmm.
so upset with the fact that once something is done in the industry in terms of transaction, it's done. I don't know if you've come across similar instances, but it's really, really disheartening to see that there's no wiggle room once the cash has been exchanged. And I think that that's a part of the problem with this being a full cash business.
Yeah.
Even though people are taking credit now, in certain states, it's still difficult.
No, I can definitely attest to some situations when I was sourcing raw material input to make extract, and I would go visit these farms, and I would love to just sit there and prod with questions until they actually expose themselves with bad practices. And it didn't take very long to like start recognizing who was struggling to survive because they were doing the right thing, and the others that were just simply doing the, I would say, the least to cover their tracks because it was so evident that their product was contaminated with either pesticides or mold
Mm-hmm.
or some other substance that I didn't want to know about. And I would tell them, like, all right, listen, if we're going to do business together, we're going to have to do R&D tests on randomized batches of the raw material. And if for whatever reason anything comes back with high pesticides, metals, mold, anything that comes up, we are not going to do business with you, plain and simple, because at that point you're covering your bases and you're not exchanging all of your resources for a product that could be null and void due to contamination. But, I don't know how many other people are being that meticulous. And that's something that I feel should be a standard because that's happening in manufacturing of supplements that get approved by the FDA.
Yeah, I agree with you. I think that's really problematic, in the sense that it's everywhere, and it's almost unavoidable.
Hmm.
And when you do, and I noticed this too as I had reps coming into my store, no one ever wants to buy from the reps who have the cleanest tests.
Hmm.
And I don't understand this. I don't know if this was unique to Michigan, or I don't know, but I when I would have people come in with clean tests, I would bring it to higher up, and would always be like, it would always, almost always be answered with, we're good with the product we have, it's reliable, it's consistent. When in reality, it wasn't reliable and it wasn't consistent, and that was the customer feedback.
Damn.
Yeah. So it's just like, there's so many signs coming from not just people who work in the store, right, who are aware of these things, but it's trickling into the consumer base to a certain degree. And once those people know, and they begin to whistle blow, it's very interesting because those same people come back, and mind you, these are generally the people who are asking for information. They're that one out of every 10 or 15 that we were talking about earlier.
Mm-hmm.
Um, they say that they're getting poked and prodded at by their friends. Why do you care so much? Why does it matter? Like, it's safe. But is it though? At the end of the day, like, they're feeling these adverse effects and that's their reality. So who is anyone to tell them that that's not their lived experience? And
Yeah.
and I really tend to wonder too, that leads me into my next point, is I really wonder what the long-term implications of pesticides in cannabis is going to be. What are we going to see long term? What are we going to see long term with even like all of this genetic inbreeding almost of all these plants? We don't really have any original clones anymore, do we? I don't know if that's just a myth or if like
Mm-hmm.
we've really bred everything out to the point where it's all hybridized. And not that that's a bad thing, but
Mm-hmm.
I also wonder like what the cannabinoid profile looks like, and then in turn that with the pesticides, like what kind of cocktail does that create once it's processed by the body?
Yeah, no, it's all very good points to and questions to bring up. I mean, this is me calling forth practitioners, chemists, clinicians who are doing all this necessary research that needs to be addressed in a public forum. And I welcome you to come on the podcast and talk about this information because these are a lot of unanswered questions that will start to arise as more states start to come online because we're moving in that direction. If we're already at think over 33 that are medicinal and then half of
Mm-hmm.
those are recreational, there is going to be a point where all the states are at a medical standpoint to release product to patients. And is that when we're going to start to get a standardization of things coming together? Or can we start pushing people to be better now, start creating a standard that they're living up to? Because I think it's important. And if you're going to be using your own product, do you want to be getting cancer from your product later down the road? That's it's just something that needs to be kept in mind. And uh, again, having these difficult conversations that no one's willing to address, I'm here for it.
Likewise, I think that everything can be displayed in an appropriate and neutral manner. I don't think that everything has to be emotionally charged in this space as it so
Mm-hmm.
tends to get. I've noticed that anybody who's gotten defensive in past times, it doesn't make sense. It's because of dissenting opinion. Opinion is entirely subjective, right? If we really want to make forward movement, we need to collaborate and organize. It's pretty much the only way forward, in my opinion. At this point, I don't really see the division and the, I almost want to say, pride that gets in the way of the well-being of all the consumers, whether that be a medical consumer, an adult use consumer, um, someone who is prescribed Sativex, or everybody deserves that quality.
Mm-hmm. Yeah, no, I 100% agree with you on that front. And that's why getting into extraction was something that was super important to me because I wanted to use the principles that I've learned from chemistry, physics, biology, and then even integrate that with the knowledge that I obtained from working along physicians in the ER for 2 years, and then seeing a private practice and how that operated, and
Mm-hmm.
just really focusing on delivering what the patient needed, not what they desired.
Absolutely. Yeah. And I think, again, I hear you loud and clear on that front. And I just think that it's going to require a lot of humility from a multitude of people. Like the big sharks in the cannabis space really need to reconsider how they are going about these processes, and also like an open call to the government to, if people are calling asking for a revision on like state by state compliance and stuff like that, like go to your local legislature and call them and tell them that you want stricter compliance, or you want ABC to be able to ensure that the product that you're getting is safe. If that is a concern, you have every right to make a phone call. And I think that's also something that people forget, that they do have the power, for those that do care. And I know it might seem like it doesn't matter, but you at the end of the day, you really never know. It might get through to someone who has the power to make that change.
So, to tie everything back together from where we started and your focus and getting your master's in science on, psychoactive compounds, and in that research front, do you think needs to be applied from the principles that you are learning to the psychoactive compound recreational space, moving forward?
What are we looking for in the I just want to repeat this back to you so I understand what you're asking me
Mhm.
fully. What should we be looking for the progression of psychoactive substances? Just
Correct.
in like, okay, again, we need research. We need research 110%. We need patient, diligent, committed research. We need passion in the space. Truly, we can't just be a passionless research space. I don't think that that's the way to go. If people who are researching these compounds
Mhm.
don't have a deep drive to make safe change in the pharmaceutical space, or the recreational space, even, because it will trickle down in the recreational space. um, in the rec space, I think that what we need to be looking for is the presence of safe, reliable product, consistent product. I think that cannabis shows, recreational cannabis specifically shows, I mean, not even just recreational cannabis though, right? Like we've learned a lot from the Wild West that was this this market that we know today.
Mhm.
It's had its trials and tribulations. It's been very messy, but I think it would be a mistake to not pay attention to the lack of regulation, the inconsistency in regulation, the inconsistency in states making those decisions. And yes, states do have the right to choose, but we are really seeing the implications of what happens in the recreational space when there's not a solid roadmap put down, because every state has different protocol and every
Yep.
state has different product.
Mhm.
So I think that for this psychoactive, psychedelic renaissance per se, I don't necessarily love that term,
Mhm.
um, but I think for us to see success here, we have to be really, really careful and cautious and really listen to times past. Like I said, especially the cannabis industry, but also just other times in history where we've seen psychedelic movements that failed. I just think there's a lot to learn in the past that can be applied to do this right and patiently, and from a place of true care and concern for like what the product integrity is going to look like.
Yeah, beautifully said. I think that is the same sentiment that I've been also moving towards, because as the psychedelic movement starts to grow now, with functional mushrooms coming to the forefront of, here's, a slew of products that just exploded out of nowhere that are being released into the public. And I'm all for it for the non-psychoactive ones. However, the ones that are containing psilocybin or psilocybin are still being distributed openly, and it's like, okay, how are you extracting it? Where are you getting the fungus from? um, what other ingredients are you mixing with this? There's no warning
Mm-hmm.
label on it. There's no indication. Maybe there are some dosaging um, instructions on there for, if you take this amount, you might be feeling this way. If you're doing X, Y, and Z, you might feel this way. However, it's still a gray zone, and it needs to be held to a higher degree of caution.
Absolutely. And I also think too, now again, I think that it's very, very important to remember that the black market and the underground will never go away, right?
Mm-hmm.
Um, they deserve the same level of respect that the market will. So I think it's very important to take into account that while this is happening, we also we absolutely cannot have the same issue that we did in cannabis in respect to like arrests. I think that's
Mm-hmm.
also something. I know it's not necessarily like involved with the like substance composition, but I think that we saw a lot of people getting arrested for marijuana possession, and things of the sort, while it was medical and even into the beginning of the recreational era. So it's, how do we negate that as well? I think we also have to pay attention to like the social implications surrounding this.
Lots of topics to cover.
I
There's
know it's just so many.
so many future episodes, and this is why I wanted to start bringing on different people from different avenues, from retail, processing, research, growing, equipment. I want to hear all the stories, because all of these opinions matter, because it's going to have us come to some point of compromise where it's like, all right, we need to come together and form a standard that gives a higher quality to the patient at the end of the day. And if there's information out there that's covering this, that allows other people to start talking about it, then hopefully change comes out of that.
100%. All we want to, like, in my opinion, like, what I would really love to see is for people to be able to make the most informed decision possible.
Mm.
Because you're
Mm-hmm.
never going to be able to control the outcome, right? As much as
Right.
people want to be able to control that outcome, humans like to put things in boxes. We
Yep.
absolutely love to be able to try to like compartmentalize things to make them make full sense, right?
Mm-hmm.
But with this, it's just so ambiguous that the best thing to do is to give the power back to the people, make sure that the science is written in plain language, make sure that the appropriate warnings are on the bags, and really give people the right that they deserve to make the most educated choice that they possibly can.
I love that. No, that was really good to end the discussion with. You drive home the point of practices, regulation, compliance that all need to be adhered to, especially with something that is a form of medicine. And, I again thank you for sharing your experiences, and also your education that you're pursuing. I think it's you're going to be highly sought out for as a counselor, therapist in the future.
Thank you greatly. That means a lot to me. It's been a long road to get to this point, but getting closer every day and feeling grateful throughout the process. And thank you again so much for having me. It was really, really cool and very fun to be featured on this pod. And I'm very hopeful for the future of the work that you're doing here. I think it's very important work, and it will definitely reach many ears who are willing to listen.
Thank you so much, Leigh. Some closing questions so that we make some light of this conversation.
Yeah.
Let's, what's your favorite genre of music?
Oh man. Okay. All right. Well, it's so many loaded questions. My brain is just kind of like, I can take no more loaded questions. To narrow it down from however many genres to like two. Um, I very much enjoy UK dubstep
Okay.
and I would say hypnotic and psychedelic techno
Hmm.
certainly fall up there for me.
What's your favorite festival to attend?
That's another tough one. There's so many that I could choose from. Um, I as a Metro Detroit, not fully native, but not born, but raised. I will
Hmm.
say I absolutely love movement. The energy that runs through Detroit during that time of year is just something else.
I have never been, and we'll see if I end up there next year. We'll see.
Would highly recommend.
Yeah, it just coincides with EDC's dates, so that's why I'm
Oh
always like,
no.
yeah. And EDC Las Vegas is kind of where I was born, so
Have you ever
uh,
been yet to EDC Las Vegas?
yeah, that was where I was born. Like raving wise, that's
Oh,
the first. That was the
really?
first major, yeah, that I got to experience.
So everything else is just
Yeah,
you can't compete.
no, I got spoiled.
Yeah, to say the least.
So, what is your dream job?
Oh wow. I think my dream job is exactly what I mentioned in the pod. Honestly, I would absolutely love to um really I would really just be honored truly to be able to establish um a practice for integration therapy. I think that's really the soul calling that I'm feeling, to be able to create that space for folks who just need to process.
I love that. That's great. And there's definitely going to be people that need that in the future. Uh, Last question. What advice would you give to someone who is going to get into your line of work?
Be prepared. Okay. That's not true. For me, I need to be prepared to know absolutely nothing
Hmm.
because we don't. There are so many open-ended options at this point because
Hmm.
it's a pioneer field, right? You have to make your own way. So I would say be prepared to fight through ambiguity and potential feelings of uncertainty.
Hmm.
That would be my number one piece of advice because some days you will wake up and, like I said, I know what I want to do. But the problem is I don't know what that looks like because it doesn't really exist yet. Um, but my hope is that someday, um, they won't have to guess. So I'm hoping that that information is outdated by the time someone like picks up on this and is like, "Oh yeah, I don't really have to worry about it because the profession exists and I know how to take the steps to get to the path." But in this current moment, be prepared for ambiguity. Um, Always act from a space of passion for your work, because this field requires passion. Truly, truly, truly. It's an absolutely beautiful space, and it's a very passion-driven space. And don't ever forget your why, because I feel like a lot of people end up in the psychedelic space because of a why. And it can be very, very much a driving force when you don't have an attached end goal. Like, so in that ambiguity, your why is definitely like your cornerstone for the journey of engaging in this type of education.
Yeah, that's the anchor that holds you grounded. So when you are having your back up against the wall, you can always return to that and recognize that your purpose is much bigger than you.
Yes, absolutely.
Well, Leigh, thank you so much for all of this. It was a pleasure to have this discussion, and I hope to have you again on the podcast in the future.
Thank you so much again for having me, Dorian. Likewise.
All right, guys. So until next time, stay tuned for more episodes. I have scientists that will be on later this month for the month of December, and I secured a bunch of other people to talk to in January from MJ BizCon. Super stoked to present all the research and development that they have to publish. So until next time, don't stop labbing.